Welcome back to Children's Wisconsin's ongoing live Q&A series. My name is Ashley and I work on the communications team. Today we're talking about COVID-19 testing. Joining me from their individual offices, hence why we aren't wearing masks, are Dr. Mike Gutzeit, the Chief Medical Officer at Children's Wisconsin, and Dr. Paul Veldhouse, Pediatrician at Forest View Pediatrics. We'll be answering questions related to COVID-19 testing at Children's Wisconsin, whether that be at the Milwaukee Hospital or throughout our primary care locations. We encourage you to leave your questions as a comment, and we'll answer as many as we can live at the end of the broadcast. If you're not watching us live, no problem. Leave a comment anyways, and we'll reply directly to you in the comments. Before we get started, if we have any technology issues, please bear with us. We'll try to continue, but may have to reschedule as we know this is an important topic for families. All right, let's jump in. Thanks to you both for taking the time to answer questions on this topic. It can be confusing, especially for families with children right now. Are we testing children at Children's Wisconsin for COVID-19 is our first question. Let's start with you, Dr. Gutzeit.
Thank you, Ashley, and I'd like to thank everybody for joining us today. This is a very important topic and very timely. I would like to also assure people that we are appropriately physically distanced, so there's no reason for us to have masks on at this point in time. We're separated from each other and from others in our office by greater than 6 feet. So I want to assure everybody that we're practicing safely. Very, very good question. I'd also like to provide a little bit of context about the state of Wisconsin and the current impact that COVID is having. As many of you probably know, Wisconsin is one of the states with among the highest rates of COVID-19 spread right now. It's a very, very serious situation. In fact, I've been in contact with some of our colleagues up in the northeast part of the state, and the hospitals there are at or near capacity and are looking to transfer patients. So it's a very, very serious situation. We want to make sure that we are covering information that is helpful to you. And just remind you always to practice the things that we know are safe practices: washing your hands, practicing physical distancing, and wearing a mask. So Ashley, the first question was about whether or not are we testing at Children's, and the answer is yes, and I'd say a qualified yes, meaning that we do have a testing strategy here. Our testing continues to evolve, and we continue to change based upon the best scientific information we have available and based on our experience. At our Milwaukee Hospital specifically, we are testing all patients who are having procedures. So that would be patients who are having surgical procedures and other types of procedures, and most of our patients that are being hospitalized right now. So the testing that we do at the hospital helps us do a couple of things. One is it helps to make sure we have the appropriate placement of the patient, the right care team, and the right personal protective equipment, PPE, available. It also helps to define what our strategy is going to be around the actual approach to the physical care of the patient while they're in the hospital. Another impact that testing has, which is very important right now based on the opening comments, is it helps our public health teams be aware of what the spread is like, especially in children. We see a lot of information about adults, but Children's is really committed to providing information to the community so we understand how that spread is occurring in children also. Paul, did you have any additional comments related to that?
Yeah, so just to piggyback on what Dr. Gutzeit said, I'm about 6 miles from them, so I think I'm very appropriately socially distanced. It's one of the nice things about being able to do a live stream is we can do this from different locations. So yeah, at our primary and urgent care locations, we're testing children who've been exposed to COVID-19, and it has evolved over time, especially since March when we had our surge to now, even a little bit some of the philosophy of clinic. I think when initially we wanted everybody to hunker down. We were trying to keep people at home. Now we're trying to be a little bit better about contact tracing and figuring out who has this so we can isolate those people. So right now at our primary care and urgent care locations, we're largely testing kids who've been exposed to COVID-19. Now, we don't have supplies to just test anyone and everyone, which is the ideal, and hopefully we will get there at some point, but we do have to prioritize kids who've been exposed. So you may call in and get an answer that you kind of don't fit into the testing criteria that we're doing at the moment. However, we can refer you out to a community testing site who does have more supplies to do that. And the Wisconsin Department of Health Services has a website. It's a great website. It's dhs.wisconsin.gov/COVID-19/testing, which is right there. So you can see that. That's a great website to go to. It'll tell you what's in your area, who's getting tested, what ages they're doing, and why.
So you mentioned exposure. How does a family know if their child was exposed or needs to be tested for COVID-19? Let's start with you, Dr. Veldhouse.
Yeah, so that's a great question. So there's testing for symptomatic patients, which we'll talk about, I think, a little bit later, and then there's testing for exposures. Exposures is a little bit difficult, and this is where it can be confusing for lots of families because they're getting mixed messages sometimes from the school or from their daycare or from even a neighbor. And the definition of exposure does change across some of those environments. We're trying to keep up with changing recommendations from the school district and health departments, but we're testing right now based on the definition of exposure here at Children's. And our definition is within 6 feet of a known person who's tested positive for COVID-19 for more than 15 minutes, even if you're wearing a mask. Now, there is an exception if you're wearing a medical grade mask like an N95. We might have kids that are working in certain jobs who are high schoolers who are working at, say, a nursing home and are wearing an N95. So if they call, they might not technically be an exposure. But really, for everyone else, the easiest way to remember it is 6 feet for more than 15 minutes, even if you're wearing a mask.
Yeah, and I know that some of our patients actually get N95 or medical grade masks based on the condition that they have. So
Correct.
Those types of people, the mask does matter if they're wearing a medical grade mask. Okay, what about you, Dr. Gutzeit? What about testing at the hospital?
Yeah, and thanks. A couple of things I'd like to reiterate. Dr. Veldhouse gave a very good explanation of some of what can be a very confusing topic, and that is constantly evolving. So thank you for that. A couple other points I'd like to make. While we are not a public health testing site, we do work in collaboration with our local health departments as well as the Department of Health Services from the state of Wisconsin. And one of the most important things about testing is that there are many resources available. I know our public health counterparts right now are doing contact tracing for significant exposures, and it's very important for families to respond to those public health officials when they're reaching out. They're reaching out in the best interest of everybody and trying to promote the public health interests. So thank you to everybody who is connecting with the public health officials and responding to those. As far as testing at the hospital goes and as far as exposures and testing, it really is a balance. We're trying to balance the available supplies because there still are some challenges with the supply chain on some of the things that we require for testing. And we want to really reiterate that the testing is geared to provide the best and safest care for our patients and the best and safest environment for our patients, families, staff, providers, all who need to be in the hospital to provide that care. We want to make sure that when we're providing care, we have the appropriate knowledge that we need to not only give the right care, but also to provide the right environment.
Okay. Now, we've heard from families who have been confused and sometimes frustrated after calling Children's Wisconsin wanting a test. An email yesterday from a family shared with us that their child was directed by their school to stay home because someone in that school tested positive. When their child started showing symptoms of COVID-19 or what they thought were symptoms of COVID-19, they contacted their children's clinic, but were told they would not get a test and were referred somewhere else. This sounds like a primary care situation, Dr. Veldhouse. So can you speak to this one?
Yeah, so, obviously we're trying to do the best thing for all people. And we hate to hear that any family was upset or got an answer that wasn't ideal. And I don't know all the specifics around that case, but testing has changed and we're working hard to make sure that all the clinics are on the same page. And we will be bringing people in more frequently now that are symptomatic than maybe we were before. March seems like a really long time ago, but it wasn't from many people's perspective. And in March, really the goal was if your kid, has a runny nose, but they're otherwise perfectly fine and you can watch them at home, please watch them at home and don't bring them into clinic. But over time, we've kind of gradually gotten better about who needs PPE in clinic and who's a positive contact and who's not, and who we want to test and who we want to keep at home. And we've gotten more supplies. Supplies were extremely limited back then. And as our supplies have gone up and our ability has gone up, we want to bring those kids in now so we can find out who exactly has this so we can really isolate them at home, quarantine their families and track this a little bit better. So somebody who we would have maybe told back in March to stay home, we maybe would have told in May maybe to stay home, and now we're telling them to come into clinic and get a test. And that's confusing to people, but that's all really, really based on supplies. So if you feel like you've gotten an answer that's really confusing, you can always ask to have the physician touch base with you later, or you can MyChart in and ask the question in a format that's easy for us to kind of review and send back to you. But really, ultimately, it might even be that things have changed from that question to now, and we're really trying to bring more people in who are symptomatic than we were before. And I would say that's even changed in the last few weeks. So if you feel like you have symptoms of COVID-19, we definitely want a phone call. We definitely want to talk that over with you. And very likely we want to get you in and get a test done.
Dr. Gutzeit, anything to add to that one?
Yes, Ashley, I would. Dr. Veldhouse is absolutely right. The science, the knowledge, the experience about COVID-19 is constantly changing and evolving. And you said something pretty profound, Paul. You said that it's hard to believe 6 months ago we were doing one thing. And it's also important to remember that we only have about 9 to 10 months of experience with this virus. It's not like the seasonal flu where we've had decades and even a century or more of knowledge to know all the answers and all the things that we can do to prevent the spread of these types of illnesses. So COVID-19 is a novel virus. And so as we continue to learn, we will focus on the things that we need to do to provide the best and safest experience. We do have some continued supply chain issues that we kind of want to work through and make sure that we have the right supplies. We want to make sure that we can continue to provide care despite some of these changes that are occurring. So we're always thinking ahead to what's the next thing that we need to be thinking about, what's the next approach that we need to take to assure that we'll have the appropriate supplies and the ability and the staff to be able to provide the care that kids need. We're all on the same page here. We want to provide the best and safest care for you and for our patients. We want to make sure that we're committed to that. And in doing that, we need to make sure that we have the right supplies and the ability to deliver that care.
Okay. So let's just put all of that in perspective and run through a quick scenario for families. Let's say a child in a classroom tests positive for COVID-19. Does that mean the other students in that classroom have been exposed and need to get tested? Let's start with you, Dr. Veldhouse.
Yeah, so this is actually my wheelhouse because I'm on the back to school work group and I have 5 kids and they're in school and I'm very active at their school. So it's also a very difficult question because every school has a slightly different back to school plan. So like I talked about before, it depends on the classroom setup and a little bit and a few of the details. So if the classroom is set up where the children are spaced more than 6 feet apart and the exposure to that child who was positive would have been less than 15 minutes, which oftentimes is going to happen maybe passing in the hall or, during a brief recess or a brief mask break. Some teachers are letting kids go outside and kind of run around the building and come back inside without their masks on just to take a break. If those things are in place, then you are not actually a positive contact and therefore do not need to quarantine and do not need to be tested. Ideally, also, we like schools to be ventilated. That's not technically one of the criteria. We want windows to be open. We want there to be good air movement. We want, good ventilation systems. But really, it is 6 feet for more than 15 minutes. However, your kid would be considered to be exposed if they're not spaced more than 6 feet apart. So if all the desks are 4 feet apart, that's what we call a cohort model. That means essentially the class is exposed, and some schools and daycares have to do that based on size. Or if it's more than 15 minutes, basically. So if you're within 6 feet for more than 15 minutes, then you're considered a positive exposure. Now, we get lots of questions from families because they got a letter from school saying that there's a kid at school who has coronavirus, and that's it. And they don't really have much more information than that. And so they call us and they're like, what do we do with that? In general, the advice is that is not a positive exposure. The Department of Health is doing a very good job with contact tracing, and they are calling people who are positive exposures. Schools are sending letters to people who are positive exposures. So if you just get the letter that says there was a case at school, many schools are feeling the need to notify people of that, but that does not mean that you need to come in for a test.
Okay. Dr. Gutzeit, anything to add to that one?
Sure. Dr. Veldhouse, thanks. That is another great explanation. And I guess what I would add is that remember in these situations, it's important to know who you can phone as a friend. Who's your phone a friend? And there are several resources that are available. The Wisconsin Department of Health Services has a phenomenal website that gives a lot of clarity around this particular topic. I want to really stress local health departments are very committed to getting out and making sure they're doing contact tracing. They are in touch with schools when there's a positive exposure, and they are doing the heavy lifting and the legwork. And as Dr. Veldhouse mentioned, you're working through your established primary care provider with your children is really important too. If you don't have an established relationship with a primary care provider, Children's Medical Group, our primary care group, can certainly help you establish that. And I think the other thing to remember is that Impact 211 is a great resource too. It has available connections that can be made. So again, think about phoning a friend. Who are those resources, those trusted resources that you can reach out to, get the information that you need, and then decide based upon that information how to proceed for the best care for your child.
Okay, thank you.
Yeah, and can I quickly add something too? Also, the school really only knows what's happening at school, right? So if you do get a phone call from another parent or from a team coach or anybody outside of school that just says, hey, my kid just tested positive, and I know, my son Ruben and his friend Ben are, best friends, and they went for a giant bike ride on Saturday, and then they, played at our house for a little while, then you should call us and let us know that. So you don't have to wait for the school or the Department of Health to tell you. There is some sort of personal responsibility here too. If you know you were exposed, and give us a call.
Okay, great. So you mentioned a team or a coach. That actually leads into the next question, which we get quite a bit. What if an athlete or camper is required to have a negative COVID-19 test result before returning to either a sport or going back to camp or even back to school? Some schools are asking for it. Does Children's do testing for kids who simply need to show a negative test result before they can do something like a sport?
Yeah, so actually this one's tough, and this is the one that I think parents probably have the most difficulty with. Is they want to go back to play volleyball. The volleyball team says they need one. But this is where the supply chain issue for us is an actual issue. We are not testing kids right now just so that they can return if they're otherwise asymptomatic and they haven't been exposed, because we do need to conserve those tests for people who are. So the answer right now to that question is no. They can call a community site. The community sites have more tests and are sometimes more willing to test in those circumstances. We're also trying to get the word out, though, to schools, daycares, camps, sports teams, that is not currently the standard of care in Wisconsin for testing, because we don't have enough tests to just do that for kind of everybody. Hopefully someday we can reach that. People I guarantee are reading about sports teams, especially professional sports teams or colleges who are testing kids en masse as they kind of come in, or they're doing what's called cohort testing, where they kind of take a whole bunch of tests and they put them in one test, and then they test that to see if maybe like an entire dorm has a couple cases. So that is all stuff that is done individually by organizations, but it's not, or I'm sorry, done as a cohort model or done by that organization alone. We are not doing that individually for our patients. So that makes it really confusing for parents. That is not testing that we're offering at the moment, though.
Okay, that makes sense. Something to note is that children 0 to 5 years of age cannot be tested at a community testing site. This is something that I don't know that everybody knows. I didn't know for quite a while. What should a family do if they have a child that young who needs to be tested?
So in that instance, they should definitely call us. And if a child's been exposed and they're under the age of 5, we would like to see them, and we would bring them in and we would test them. Or the family can call 211 if they don't have a children's physician, and they can get connected with somebody who would test. So in the 0 to 5 age range, we're being particularly careful. We would want to bring them in, probably even do an exam and do a test. Although, to be clear, some of our sites are actually testing with just the nurse, so you may not have to have a full doctor visit. You can come in and just get a swab with one of our nurses or MAs, and they can take care of it from there.
Okay.
The Wisconsin Department of Health Services has a website with local health department testing capacities and availabilities, and that is a very good question, Ashley, because Dr. Veldhouse is right. There are many public health testing sites that have an age limit, a lower age limit, just because of the difficulty in collecting specimens. Thank you for putting the website up again.
Yeah, that's the website that Dr. Veldhouse mentioned earlier. Okay, what about daycares? Can children, similar to what you mentioned, Dr. Veldhouse, with sports teams that we're seeing on the news, can children partner with daycares to administer regular tests, like daily testing?
I can take that one, Ashley. This is a very important question because we have been approached by children's has been approached by daycares, by public health departments, by schools to ask about our ability to provide testing. And while we would like to meet every single need, as mentioned earlier, we have limitations in terms of staffing, supplies, availability of supplies, and just the ability to test in general. So what we've done is we have partnered. We are always willing to talk to schools and daycares and public health departments about the approach and how we can partner in those ways in terms of sharing knowledge and expertise. Unfortunately, we don't have the ability to do all the testing. However, what I would say is that we do, as Dr. Veldhouse mentioned, our primary care sites have the ability to do testing, and they are happy to establish relationships to make sure that that's done appropriately.
Okay. So if a child is going to be tested at a children's location, say they have had a confirmed known COVID-19 exposure, or perhaps they're having a surgery, what can they expect with that test? Let's start with you, Dr. Veldhouse.
Yeah, so they're two slightly different questions. If a child is getting a test for a surgery, actually we have it set up at the hospital, and Dr. Gutzeit can correct me if I'm wrong, but the test comes back very quickly. So in that instance, we would test so that they can have their surgery same day. We get the test back, and that dictates a little bit what the team that's taking care for that patient has to wear for PPE and what's going to happen that day. But in that instance, we wouldn't quarantine the family because we're waiting for that test. That test is going to come back in hours. However, if you come into my office because your kid is sick and I'm swabbing for coronavirus, that test can come back anywhere, typically from 1 to 3 days. It was really hard back at the start because they were taking 4, 5, 6, sometimes a week to come back. And so then I had to tell parents like, hey, well, we wait this extended period of time for tests to come back. Your family should also be in quarantine because this is a suspected coronavirus test. That still does apply. So even though the tests are coming back quickly, it does mean probably we're not going to have it till the end of the day tomorrow or even the following day. So really the family should be quarantining while we're waiting on a test if we're doing that on a symptomatic patient. And the reason for that is if I have enough of a concern that I'm swabbing for coronavirus, that means this possibly is coronavirus, and really the family should not be out in the community while we wait for that test to come back. Now, once the test comes back, if the test is negative, then we revert to when symptoms are improving, we've been fever-free for 24 hours, the kid can go back, but really the family can come out of quarantine once the test is negative. But while the test is pending, the family should really be quarantining as best that they can.
Okay, and you mentioned potentially surgery and at the hospital being different, so we'll have Dr. Gutzeit speak to that a little bit.
Yeah, thanks, Ashley. It is a little bit different at the hospital in terms of the turnaround of the tests and also the approach. And the approach in the hospital is really patients that are going to need to be in the hospital or are going to be coming into the hospital. So let me talk about the drive-through option first. For patients, as we mentioned earlier, for patients who are going to have a procedure done, say a surgery or some type of procedure that would require them to come into the hospital, we do a test typically about 24 to 48 hours before they come to the hospital. We can turn that test around quickly enough so that we know the results before they come to the hospital and then make the appropriate arrangements so that it's a safe environment and a safe process for the visit to the hospital itself. Now, for patients who are admitted to the hospital, the big decision point there is not only what are we going to do around the care of the child, but where are we going to place the child? We want to make sure that we've got the child in an appropriate room with the appropriate protective equipment and nursing staffing that meets the need of the patient and family. So for those tests, we do very quick test turnarounds so that we can make sure we've got the patient appropriately put into the room that will best benefit the patient as well as the care that the patient's going to receive.
Okay. So you both mentioned kind of nasal swabs. We've heard a bit on the news about how uncomfortable some of these COVID-19 tests can be. Can you help parents understand what to expect when getting this test done so they can prepare themselves and their child a little bit before the test?
Yeah, so this is a tough one because it might even depend on the day you show up in clinic which test you get. So there's a few different tests, but really the two that we've largely landed on in kids are what's called a nasal test or a nasopharyngeal test, or what is frequently called an NP. So the difference really is the nasal test is kind of like picking your nose. It's in the front and it's just a little swirl around right here. It's briefly mildly uncomfortable, but kids stick their finger up there and it doesn't seem to bother them too much. So when we stick the swab up there, it's a lot like that. The one you see about on the news, that's the NP swab, and it definitely is a little uncomfortable. I think sometimes the joke is when I pull it back out, I say, oh, is that a little bit of your brain on the end there? Because it feels a little bit like that. It's not, it doesn't actually go back that far. There's a bunch of tissue before it hits your brain, so don't worry about that. But it goes back and it goes into this portion of the nose, which is like kind of the back of the sinus. So most people get some watery eyes or kind of woo afterwards. It's quick though. We can kind of go in, swirl, and come back out. We have to do one for pertussis where you have to leave it in for a full 10 seconds. So it's not quite as bad as that, but it's briefly uncomfortable. Now, also, so are throat swabs for strep. I have many of my patients who say, are you doing that thing where it goes in my throat? And I say, oh no, this one goes in your nose really, really quickly. And we boom, bang, and then it's over. And the doctors have gotten quite good at making it sort of as a little uncomfortable as possible. But it is okay depending on your child. Whether you want to have a brief conversation with them about it, if you think that's something that your child, like some kids need prepped. Like it's actually really good to tell them like, hey, the doctor might have to do this test. They're going to try to do it really quick. They're going to get it in, they're going to get it out, but it might make your eyes water. We'll get you a tissue so you can blow your nose right away afterwards. You can hold mom's hand, whatever we need to do. Some kids, if you tell them that, then it's just from the get-go, are we doing it? Are we doing it? Are we doing it? And they kind of can't get past it. And there can be tears even before the test happens, and it can be incredibly difficult then even to do the test. So there is a component of knowing your child a little bit and knowing if they need prepped or if it's a little bit better to kind of tell them right beforehand and make it happen. It's a lot like shots or a rapid strep test or some of the other things that are briefly uncomfortable that we do in the office.
Okay. Dr. Gutzeit, anything to add about what to expect with the test?
Sure. Actually, I could talk a little bit about the test and then maybe the types of tests too. And we could spend probably the whole hour talking about different types of tests and get into all the different science around it, which is fascinating, but probably would extend us out beyond the time that we have. I did want to say a couple of things. Dr. Veldhouse is absolutely right. There are two types of tests right now that we use commonly: the nasal and the nasopharyngeal swab. For the actual getting the specimen. And one of the things that we are very fortunate at Children's is that we have expertise with pediatric providers and nurses who are very, very comfortable with this, and they do it frequently. So that's why, if you are part of the children's system and you have a children's provider, they can do that, the test and do it effectively and with the best attention to the anxiety that it can produce with kids. I did want to spend a few minutes talking about the actual tests themselves because there's a lot of confusion around this. One other test that has been talked about is the saliva test, the so-called spit test. You can spit into a little tube and then you can use that as a specimen. That test has not rolled out as quickly as we had hoped for, and it still has some challenges in terms of its accuracy. So while it is gaining a lot of attention in some circles, we want to make sure that we have the right test. So we'll wait to see more information. We expect that will become a test that could be used. I'm not sure how effective it will be in younger children just because of the ability to be able to spit. So we'll see about that. The saliva test is one that some people have heard about, but we're still focusing on the nasal type of test as our approach. And basically, there's three categories of tests that people may hear about. The initial tests that were used were called amplification tests. So there's a lot of other names for them, but those are tests that take a part of the actual DNA or RNA material, the extra nuclear material of the COVID or the coronavirus itself, and through a series of different lab maneuvers and magic, it extracts various pieces of that, and then a test is performed on that. Then came the antigen tests, which are different. They detect proteins on the actual virus itself, so it's a little bit different. And these tests are rapidly available. So those tests are ones that are used now too. And then a third test is the antibody test, and that is usually used to test if you've had an exposure to coronavirus. It's not very effective for testing if you actually have the virus itself right now. And there's various strategies around this. A simple thing to remember is that the more rapid the test, the more likely it is that there is a higher margin of error for the test, because some of the steps, the sequential steps that are necessary in the more complex tests are not done on those rapid tests. And while they can be effective, I'm not saying they can't be used, you just have to make sure you've got the right approach to how you're using those tests and where you're using those tests. So again, just a reminder, we've got tests that are used to test for the nucleic acids, the DNA material. We've got tests that test for antigens or proteins, and then there are the antibody tests, all are used for different strategies, different approaches, and most importantly, talk to your provider about those tests if you have questions, because they can answer the questions about why a test is done or why we're performing it.
Okay, a lot of good information. Thank you very much.
Yeah, and I'll even jump in really quickly. We are 100% aware that a highly sensitive rapid test that you just do in the front of your nose is the best one. And the children's primary care team is definitely working towards getting one. We're probably not that terribly far away from having one that we can regularly roll out to patients. So we're working on it. But if you're coming in right now, you're probably seeing that supply chain effect where you're going to get kind of what we have at the moment.
Okay. Now, you both mentioned the effectiveness or accuracy of COVID-19 test. Dr. Gutzeit, can you talk a little bit more about that accuracy? I think you already hit on it, but can you talk a little bit more about it?
Sure, I'll be happy to. The initial tests that were done before the rapid test became available were done through a series of complex laboratory maneuvers and processes. And those tests are anywhere from 97 to 99% accurate, which is about the best you can do with almost any test. The newer tests, the rapid tests, sometimes have an accuracy level that's a little bit lower than that. And it depends a lot on the test itself. And it also depends on when the test is being done. So Dr. Veldhouse mentioned this, I want to reiterate it. If you come in and you have symptoms, the rapid test is likely going to be much more accurate. If you don't have symptoms, doing the rapid test may not be as accurate because it depends on the amount of virus that you have. Think about your nose. If you've got a lot of virus in your nose, it's easier to get the virus out and do a test on it. If you don't have a lot of virus in your nose because you're asymptomatic for whatever reason, it may not be the most accurate test. And Dr. Veldhouse, would you like to add anything more about that? Because I think that sometimes is a confusing question, or a confusing concept for people to understand.
Yeah, no, I would totally agree with that. So, and again, this is one of those things where what we're learning has evolved, right? So we even had a period in time where we had the nasal and we had the NP in clinic. And, to be perfectly frank, we made some decisions about which kids look sicker, where we could do a more rapid test, which kids, like you said, were asymptomatic, or which kids could tolerate an NP test, which kids were littler. So there were even some days where it was a doctor call on which test you got based on kind of what we had on hand, because we only had so many of the nasal tests, so we were kind of conserving them. And then we had lots of the NP tests, but obviously they're the more uncomfortable one, but again, more accurate. So there was this, and for lack of a better term, ball juggling, where we were trying to figure out how many tests we had and who was asymptomatic, and maybe we needed an NP. And if anybody's interested, there's like a slideshow that we have that we change, that we update with the new tests and the new everything. And it's like 70 slides long, and the doctors get it every week, and we review it and we kind of go through it because we really are trying to get the most accurate test, but also the quickest and least uncomfortable test.
Great. Okay. That's, again, a lot of good information. It looks like we did get quite a few questions. Before we jump into those, is there anything else you want families to know? Let's start with you, Dr. Veldhouse.
Yeah, I think the first and foremost thing I would say, especially to my patients, but really to all of our patients, is thank you guys for kind of bearing with us. We know it's been a long 6 months. It's been an interesting 6 months. Things are changing. Patients, again, that we were keeping out of clinic, now we want to come in. Tests that we didn't have, now we do have. So this is one of those things where if you don't know, you do need to call. And we expect all of those phone calls. We are trying to be as sort of loving and kind and respectful as we can be with our patient population, because it's been as difficult for them as it has been for us to keep up with everything that's going on, probably even more difficult. So if you're unsure, don't feel bad. Call us, chart us, and let us know what your question is. And then also get your flu shot. So it's going to be a weird year. And the last thing we want to do is mix influenza with coronavirus, because we know a lot about influenza, but we don't know a lot about coronavirus. And anytime you take something new and you mix it with something old, you get something like even more new. And that could be bad. Maybe it won't be, but influenza is never very fun. And so getting a flu shot is going to be a great idea this year.
Okay, what about you, Dr. Gutzeit?
Let me double down on the flu shot. I would absolutely agree with that. We get flu shots every year, and at Children's we require all of those who are in patient care and in the environment to get flu shots for that very reason. It's never been more important than this year, and I think it's really, really important that everybody makes a commitment to getting their flu shot if at all possible. The thing that I'd like to remind you is that Children's is a community resource. We're here to serve our community. And we want to serve our community, and we want to especially serve our community during times of stress, such as COVID-19 has brought upon us over the last 6 months. We are open, all of our services are open, and we realize sometimes there's lots of questions that you have before you come for care. As Dr. Veldhouse mentioned, we're a phone call away. Call your trusted primary care provider. Call Children's itself if you have questions about a procedure or a clinic visit or something like that. But we want to make sure that we assure you we are committed to providing the safest environment for our patients, our families, our staff, and everyone else. There's nothing that's more important to us than that. When patients and families walk across the threshold of any of our sites, their first expectation is that we're going to keep them safe, and we are committed to that. So I just want to make sure that people understand that we're open for business. We are going to do everything we can to keep you safe, and we want to provide those services that are needed. Don't defer care because you're concerned about COVID. We can manage that. We can work with you. We can do the things that are necessary, whether it's a primary care visit or a visit to have surgery. We're going to do whatever we can to make sure that you're safe.
Okay, great. All right, we did get quite a few questions. Thank you for everyone for submitting the questions. We're going to get to as many as we can right now. Let's jump in here. It looks like the first one is, why is it that when my son tested positive for COVID-19, I was never offered any kind of check? I think that means like they were never offered as a parent or an adult a test at that visit. Which one of you would like to take that one?
Yeah, I'm happy to take that one. So unfortunately, we're a children's hospital and we are pediatricians. And so our care really is directed at the kids. Just like many adult physicians are not bringing in children to do coronavirus testing on them or offer them vaccines. There is a distinction between what they do in the adult medicine world and what we do in pediatrics. If your child tests positive, what we encourage you to do is call your physician. If you don't have one, the same website that we put up earlier, you can certainly go to that website, or you can call 211 and find a testing site for yourself. And largely that's because if you come in and we test you and you are positive, we're assuming your care. And as much as I remember from medical school, I don't actually think you want me to be your doctor if you're an adult. I'm really good at kids, but you don't want me to be your adult doctor. And so we want somebody who's testing you to follow up on that test and to know that you're getting care somewhere where it's appropriate.
Okay, great. All right, let's look to the next one. Will you test kids who are exposed but asymptomatic? So we talked through those scenarios earlier. So what if they're exposed but maybe they're not showing any symptoms? Along with that, what about infants? So that 0 to 5 age that we talked about.
Yeah, so exposures, the kids under 5, we want to bring them in and we want to test them. Typically day 5 after an exposure is the best time because they can't get tested anywhere else. What's interesting about getting tested for an exposure is it does not actually take you out of quarantine. So if you're exposed and you come in at day 5 and you get a test, that doesn't then free you up. You actually have to remain in quarantine because The test, as Dr. Gutzeit said, is not perfect, especially if you're asymptomatic. And so the Department of Health and the CDC have said that that test is not good enough for you to then say, I'm fine and I can go interact now with other people. You really have to do a 14-day quarantine. So partially for that reason, partially because there's good community testing sites, we are sending most kids who are in exposure now out to community testing sites. That may change again in the future as we get a little bit more supply. So up until 5, that's largely in our hands because nobody else will test them. After 5, we're recommending community testing, largely because, again, it doesn't really get you anything other than knowing if maybe your family also needs to now isolate and get tested. So it's more of a contact tracing problem, which is the Department of Health's area, as opposed to an actual like patient care. We want to make sure that your lungs are okay and you're okay, and that there's no like medical need that we need to address right now. So that's why we're deferring some of those kids to community testing sites at the moment.
Okay. Dr. Gutzeit, I think this next one makes sense for you, talking about hospital staff. Can staff get tested at Children's Wisconsin?
The answer is yes, absolutely. Very early on in the pandemic, we realized that one of the most important things we needed to do was preserve our staff so that they could provide the care that's necessary for the kids that come to our primary care sites, the hospital, the clinics, places like that. And so we developed a strategy with our employee health and wellness team here at Children's to test our staff. So we actually have an approach based upon symptoms. As Dr. Veldhouse mentioned, if there are symptoms or exposures that are significant, we would do the same type of approach that the primary care clinic would do here at the hospital. And we would ask various questions and then determine whether testing was appropriate or not. And if testing were needed, we would be able to do that. I would really reiterate Dr. Veldhouse's statement about the quarantine period. The testing does not give you a free pass or a get out of quarantine free approach. It's something that is really dependent upon what the guidelines tell us and what the approach is. And the reason for that is because it's so important, especially now in Wisconsin where the spread of COVID-19 is almost uncontrolled. We really need to follow the standards that have been established to get things back under control and reduce the number of individuals with COVID-19.
Yes, our employee health and wellness group has been hard at work answering questions from staff and helping them get tested. Okay, next one, let's take a look here. If a child is presenting symptoms, things like runny nose, fever, cough, but has no known exposure, is it possible to have a child tested maybe for reentry to school? But if they have symptoms but no known exposure, can we get them tested at Children's Wisconsin?
Yeah, the answer to that is yes. The reentry to school question is a little bit dependent upon your school. However, most schools have adopted, if you are sick and you have proof of a negative test, then once you are fever-free for 24 hours and your symptoms are improving, then you may return to school instead of doing a full 10 days of isolation. So the test is a little bit of a get out of jail sickness card, but not a get out of quarantine card if you've been exposed. So I know that's confusing, and sometimes it's confusing to me. But if you are actively sick, essentially what the negative test is proving is this is something else. And once you're improving from that something else, then you can go back to school just like you would in any other school year. But yes, we are happy to bring you in and test you if you're not exposed, but you look like you have something else. In fact, what's interesting that's going on in clinic right now is I have families that come in and say, like, I think my kid has strep throat again because he gets strep throat every time or every year at this time, and he's got all the symptoms of strep throat, and I look and it looks exactly like strep throat, and I test him and he's strep throat positive. I am also still offering a coronavirus test to those patients. And the reason for that is because we don't know much. We don't know if like strep and coronavirus actually travel together sometimes. And we don't know, like, if you have this one thing that you're not co-infected means like together with something else. We don't know that you're not co-infected with coronavirus. So we're kind of offering tests to anybody who's symptomatic, even if they're coming in thinking that they have another illness. And even if sometimes we prove it's another illness, you may still be offered a coronavirus test. So symptomatic patients are largely going to get tested, yes.
Okay, and I guess that makes sense that even outside the coronavirus pandemic, if your child is sick, they would call their doctor and come in, and we might test for COVID-19 if we think those symptoms are related. Okay, that makes sense.
I think it is important to add that the most common virus right now is coronavirus. That's the most common virus circulating in the community. However, Dr. Veldhouse is right, there are others. And as we go into get into the typical respiratory season, we'll likely see more of those other types of viruses. So that testing approach that he described is absolutely the right thing to do.
Okay.
Yeah, in fact, I think, with a crystal ball, we're probably going to be doing a lot of, your kid might come in and get a flu, strep, and coronavirus test all in the same visit. So we'll kind of see what the season brings.
Okay. It's important to get the flu shot for that reason.
Important to get a flu shot.
Yeah. Okay, this next one I think we can probably answer pretty quickly because I think we've gone over most of it before. If my son is having surgery in November at the hospital or surgery center, would he need a test beforehand? And then the second part of that question is, if I'm a parent staying overnight with him, would I need a test?
Well, first of all, I hope that the surgery goes well. I know if you're coming to Children's, you'll be in the best hands possible. So I'm confident of that. The answer is yes, your son will need a test prior to the procedure. You'll be contacted by somebody from the hospital to set that test up. And it's actually by appointment. We work with you to make sure the appointment's convenient, but we do that. It's a drive-through process. As a parent staying overnight, we don't test family members because of the inability to have the supplies necessary to test everybody that comes into the organization. However, we do ask screening questions, which is very important. So the screening questions would include, do you have a fever? Are you feeling ill? Have you been exposed to anybody who's positive for coronavirus, for COVID? Those are all questions we would ask. And then if anybody would screen positive, we would ask them not to be in the hospital setting, but to have another person be there for them.
And then Dr. Gutzeit, correct me if I'm wrong, but that parent would also need to wear a mask while in the Children's Wisconsin location, right?
Yes, since the beginning, since we started to initiate the mask usage and became more widespread in March, we have had everybody in the environment wear a mask, including parents and family members and others. So that's something that we do for each other, right? It's important for us to protect ourselves. It's also important for us to protect others.
Okay, great. An interesting one I hadn't thought of. Here we go. Do children need to get tested before a dental procedure?
We don't typically, I can take that one. We don't typically test before dental procedures unless that dental procedure would be an operating room procedure. And we had a lot of discussion around this. I actually had a chance to tour our dental clinic just the other day to see what they've done. And I can assure you they've put some very, very good measures in place to prevent the spread of infection. The question is important because you think about dental procedures where the mouth is open and there may be a higher risk of things being transmitted. But what the dental team has done is they've put in place some measures to make sure that there's a minimizing the amount of spread that could be occurring. And they also do a very vigorous screening process too for any of the patients coming into the dental clinic itself.
Okay. This one's an interesting one. I heard someone say that we shouldn't get a flu shot this year because if we're wearing masks, we're protected from the flu. Is that true?
It's true that you get some protection from flu, but if masks were perfect, we would not be in the situation that we are in now. So masks mitigate, which mitigation means slows down, but doesn't mean goes to zero. So it'd be amazing if masks kept influenza, to 0% this year, but I don't think anybody's anticipating that at all. So while we may get less circulating virus and kind of in the schools and everywhere else, it's not going to be 0%, and a flu shot is still going to be protective and going to be helpful.
Okay.
Get your flu shot and use the mask as a booster.
There you go.
Yeah, that's a great way to put it. And actually, just to remind people, in Wisconsin so far, from a pediatric standpoint, we had flu deaths last year. Coronavirus, we've had 6 months of it, and it hasn't been as deadly yet. Or we don't want that to happen. Obviously, that's what the hospital is doing, is taking care of kids, so that remains that way. But coronavirus is the thing that's on everybody's radar, but influenza is still a deadly virus. If you Google influenza pediatric deaths, you're gonna get some hits, and that's highly unfortunate. It's why we want people to get flu shots.
Yeah. As a reminder, the website we mentioned earlier is childrenswi.org/flu for more information about the flu vaccination, as well as how you can schedule a flu shot. Okay. Let's move on to the next one here. If a child tests positive and needs to go to the hospital for any reason, so if they did have COVID-19 and were experiencing complications and needed to go to the hospital, is the parent allowed at the hospital with the child? This one sounds like a perfect one for Dr. Gutzeit.
Thank you. Yes, and that's a really good question. One of the things that was very difficult for us is we had to make a decision early on in coronavirus to limit the amount of visitors in the hospital, and so we had to limit the visitors to the bedside with a child. And that's a very difficult thing for us because we're a family-centered organization. We want to make sure that we have the right support there. But like every other organization across the country, we had to make some decisions about what was in the greater good of the public health. So we did limit visitation. We still do have limitations, but we have never eliminated a parent traveling with their child and being present for the child in the hospital. So yes, as a parent, you will be able to be with your child in the hospital, and we have some limitations around that, but you will be able to be there.
Okay. All right, it looks like this might be our last question that we're able to take right now live, but as I mentioned earlier, please continue to add questions in the comments section and we'll try to answer those via comments after the live broadcast is over. All right, last question, here we go. If a child is under quarantine because they've had a positive exposure but has 0 symptoms of COVID-19, is it safe to get a flu shot after that quarantine, or should they wait even longer just in case?
Actually, this is a fantastic question that we do not really have any evidence for. And so we're kind of going off of just general recommendations and other viruses. And the reason for that is because coronavirus is novel. We've not had an influenza flu shot season with coronavirus. So in general, I think what many places are doing is saying once you come out of quarantine, you can get a flu shot. And that is what I'm telling my patients. Part of it is if you're in quarantine and we can wait for the 2 weeks to be up for you to come into the office, that's ideal. If you're symptom free and you're in quarantine, we don't really want to bring you to the office for a flu shot if we can avoid it. So when your 14 days are up and you're free and clear to kind of be out and about, then please come in and get your flu shot.
Okay, great.
I think this gets back to the point of the evolving science around this. Dr. Veldhouse is absolutely right. This is the first time that we've had this experience, so we're trying to be uber safe and balance that with getting the flu shot because we know that's important. So I appreciate that answer.
Yeah. All right, it looks like those are all the questions we got today. If we didn't get to your question, or if you aren't watching this video live, no problem. Leave your question in the comments and we'll reply to you directly. Thank you again to Dr. Gutzeit and Dr. Veldhouse for taking the time to answer our questions, and thank you to our audience for joining us today. For more information about COVID-19, please visit childrenswi.org/coronavirus. There you can find all kinds of resources, from details about children's locations and what we're doing to help prevent COVID-19 to more information about testing for COVID-19. As always, if you have any questions specifically about your child's health, please do not hesitate to call your child's doctor's office, use MyChart messaging, or our online urgent care. Thanks, everyone.
Thank you.
Thanks, everybody. Bye-bye.
Yep. Bye, guys.